today visiting with Steve. He is at the end of his Invisalign treatment. Steve has been an awesome patient, very awesome patient, great dear friend of mine. He is so kind to share his experiences with others. So I'm going to ask him just a few questions, and so we can share what your experience has been like with Invisalign. Is that okay?
Yes, ma'am.
All right. So sometime a year or so ago, you decided that you wanted to pursue Invisalign. Can you give us a little bit of history about maybe what your purpose of deciding to do that was and what your experience has been like since we've done this?
Well, ever since I was younger, it was my front teeth were slightly crooked, and and the two teeth beside my two front teeth, I had to have bonding put on those.
Okay.
In order to give it a more straight and correct look.
Okay.
And I was always self-conscious about that. So I thought, well, I'm probably reaching the point where I probably ought to have something done with it, because it looked like it had started to get worse.
Okay.
And I don't want to do braces, but then I talked to you, and you had told me about Invisalign, and it sounded like a much more reasonable option for what.
So when we finished up, we went through a process where we did a couple porcelain veneers on the teeth that were pretty rotated that had the bonding to replace those. And then at the end, we ended up adding some little kind of additive composite fillings on those lower edges of those. Talk to me a little bit about that process for you and how that's been.
I mean, I thought the process went extremely smooth. Now, at first, I didn't know much about the veneers versus the bonding, because I had had bonding previously. But once you explained to me how, they're much more durable, they'll last longer, the color matches better, and so I thought, well, I'll try the veneers, because I don't want to come back in 5 years and have to have rebonding done.
Okay. So a little bit more of a long-term approach for you, and hoping to be kind of ultimately in a place that you're stable for a long time.
Yes,
with your dental needs. Okay.
Exactly.
Okay.
And I mean, once we had the veneers in, they look great. They look like my normal teeth, so I'm quite happy with it.
We're hopeful with that, aren't we? We're very hopeful. So we used some digital technology. You'll see the iTero here that's with us today. So
pretty crazy.
Yeah, so we use dental photography to kind of show before and after, so we can document the progress. And today we're here taking our last scan because we've completed treatment.
Hallelujah.
It's been about a year, what did we say, 4 months since we started, so about a year and 4 months. And today we're scanning for our final retainers, because teeth move until we die, which we know, we've talked about that, and all the shifting you were having prior without wearing retainers will continue. And so, so you're going to have retainers that you're going to wear at nighttime, and ultimately, so we can keep your smile nice and beautiful as you've worked so hard on it over the last. Yes. All right. Anything else that you would like somebody maybe considering Invisalign, or someone that's kind of on the fence about, is it painful, is it, that type of process that you might want to share with someone considering treatment?
I would certainly recommend it.
Okay.
I'm sure there are folks out there that Invisalign won't work for them.
Yes.
But, I would say certainly seek the consultation of your dentist and find out if Invisalign will work for you, because it's really not that intrusive, if you will.
Okay.
And you do have some control over when you can take them out, and, which you don't have with normal braces and things like that. So, it was an effective solution for me, and if I had to do it over again, I'd do Invisalign again. I think it was the perfect solution, and I'm very happy with the results, the way it turned out, and that's what I was after.
Well, thank you for being such a great patient.
Well, and thank you for being such a good doc.
Well, thank you. And so in this era of COVID, since I can't hug you, we'll do a little elbow bump and say how much we appreciate you. Thank you so much.
Thank you.